Welcome to another episode of your show, Medical Talk from the Desmond Diabetes Institute. I'm Dr. Mohammed Al-Muhtab. The public relations team at the Desmond Diabetes Institute plays a crucial role in promoting the Institute's initiatives and programs aimed to combating diabetes. Their efforts in this summer included organizing the annual summer internship program and educational cooking classes for children and their families, which integrate practical diabetes education. They also manage the newly revamped DDI website, ensuring the efforts valuable resources and easy access to information about courses, activities, and programs available to the public. In addition, the PR team works to foster relations with educational institutions such as Kuwait University. The PR team enhances awareness and educational about diabetes, reinforcing the Institute's commitment to improving public health and supporting diabetes research and management. To know more about their efforts, we are pleased to welcome Ms. Munera Al Ghanim, a Senior Public Relations Specialist at Desmond Diabetes Institute, not now, but right after this short break. Welcome back. We're happy to have with us in the program Ms. Munera Al Ghanim, a Senior Public Relations Specialist at Desmond Diabetes Institute. Welcome to Medical Talk.
Thank you. Thank you for having me, and welcome to Desmond Diabetes Institute.
Thank you so much and thank you for having us. We have so many questions for you.
Sure.
Your department is considered one of the most important departments, in my opinion, at the Desmond Diabetes Institute. But if you can give our viewers a brief summary or description about the DDI specifically and the role of the PR and media services in your department.
Desmond Diabetes Institute is a research institute at its core. So our main functionality is research. However, you also have a diabetes epidemic that people need to be educated on, people need to be treated on, and hopefully prevent it from becoming far worse or expelling into the next generations. So that's what we try to do. Our main core as an institute is research. So what we do is elaborate on the latest research findings in PR and media services. So we educate the public on research topics, research findings. What are our scientists doing? What have they found? Something relevant to the population. We also, with respects to the medical sector that we have, we educate the public on the latest guidelines of diabetes care, treatment, and management. Also, we train our youth on these guidelines that we share with the public on the latest research findings, so they can take it to their institutions and their universities, their schools, and share it with the population in and of itself. So that's what we do.
That's wonderful. And in your opinion, when it comes to diabetes, why education is very important specifically?
So education is the shield against all disease. So if you have a population that is uneducated, you reinforce that disease from spreading. So what we try to do is improve health, improve public knowledge, public awareness with education. And you can only do that with public education.
Absolutely.
And also education in and of itself creates a population that is self-reliant, that can self-manage disease, that is self-informed, to where they are capable in and of themselves when they address a doctor or when they talk to a doctor
Exactly.
about any form of disease, it turns into a dialogue
Yes.
versus a prescription.
Exactly.
You know what I mean? So, yes, the doctor is knowledgeable about his or her field, but the person is knowledgeable about themselves.
Exactly.
So when they open dialogue and they are educated on such topics, then it will be a useful conversation to where they can both reach middle ground, and hopefully the person can be content with whatever the doctor has prescribed for them.
Yes,
If
absolutely.
that makes sense.
It makes perfect sense. And in an essence, basically, it improves the language and the communication
Yes.
between the patient
Yes.
and also the healthcare
And it
professional.
also gives them a or a form of self-empowerment,
Absolutely,
to
yes.
where they feel like, no, a disease doesn't define me, or diabetes in this case doesn't define me.
Yeah, this is
Whatever
something.
the-
This is something we can basically deal with.
Yeah, I can manage it with the treatment.
Knowledge and
Exactly,
Yeah.
with treatment, with prevention. I adhere to my appointments,
yes,
which is the biggest issue that we all face. I feel I can adhere to my medication, and to where they can see use with that treatment.
exactly.
I hope so. We all
Absolutely.
hope so.
Now, could you provide us more details about the types of the programs that you provide and activities as well, specifically for the public here at DDI?
We have a lot, but for the public, it depends. We have, and of course, I think my colleagues have also explained, diabetes in and of itself is categorized into type 1 diabetes, type 2 diabetes, gestational diabetes, and there's also MODI, mature onset of diabetes young. Now, with respects to our education programs, we have programs for type 1 diabetes. Those programs start at the age of 7 to 10. Our program is called Desmond Juniors. We have Kickoff, which is, I think, 11 to 15, ages 11 to 15.
That young.
Yeah, that young. Because type 1, what we try to do is carry them along a journey to where they are well informed how to manage their diabetes. So we start with Desmond Juniors, 7 to 10, Kickoff, 11 to 15, if I'm not mistaken. We have Wicked, 15 to 18, and we have Daphne, which is 18 plus. That is with respects to type 1 diabetes.
Each age is specific, basically.
Yes. So the younger ages can come with their parents. The older ages should be well informed of themselves, to where they can self-empowerment, remember? So we try to get them to be okay with managing their diabetes. We also have educational programs for type 2 diabetes. We have Diabetes Journey for the older diabetes patients. We also have educational sessions, so it's one-on-one in our education clinics. We have programs, cooking programs, which were very well received for people with type 2 diabetes as well.
So basically, you're offering different programs to different, basically, category of patients.
Yes.
Okay.
And with the knowledge set of that age. So with patients with type 1 diabetes, the public can also join. With type 1 diabetes, we try to carry along with their journey. So we give them from 7 to 10 in Desmond Juniors, we give them the knowledge that they would understand
Exactly.
at that age
The language
group.
and the words and
Yes.
basically.
Yes.
Yeah.
And then we carry along, and as the courses get for an older audience, we broaden their horizon.
Absolutely.
With respects to patients with type 2 diabetes, it's much different. The language is different. They've had type 2 diabetes for sadly for a longer period of time, at least. And they are well versed, we hope, but if not, we are willing to educate them right from the get-go, because sometimes somebody repeats a mistake that they're not aware is a mistake.
Oh, they think it's right. What they're doing is right.
Yeah.
Yeah.
But it's not really a mistake. We don't try to treat it as a mistake. We're re-education.
Yeah.
So how about you try to do this?
Yeah. There's a
It
better
will help
way.
you
Yeah,
better.
yeah,
Yes.
exactly.
Yeah.
Well, that's all wonderful. We still have more questions for you, but we have to take a short break. We'll be right back. Stay with us. Welcome back. We're still talking here in the studio with Ms. Munera Al Ghanim, a senior public relations specialist here at Desmond Diabetes Institute. Ms. Munera, before the break, we were talking about the programs you're offering. Currently, I understand there is the summer internship program that you're offering.
Yes.
Can you, I'm so excited about it. Can you tell me more?
Thank you. We are too, because it creates a busy buzz,
Yes.
sort of in the summer.
Yes.
So for the past, I dare say 3 or 4 years, we've been running this program successfully, alhamdulillah. So every year we offer graduates and undergraduate students with an opportunity to get some work experience in the biomedical and the clinical research field. Now students apply with their CV. It's like they're applying for a real job. So they apply with a CV and then we accept them depending on the department that they had applied for. Now during these 2 months, they gain experience, research, medical, under supervision, how to run projects, research projects, sciences projects. So it's hands-on experience. After that, towards the very end of the program, they design a research poster and they present it in this atrium here.
Wow.
And they explain it to their peers in Desmond. So you have the researchers, the scientists, the medical staff, the healthcare professionals, and they explain what they've done in the summer.
So it's more of like an academic experience as well.
Yes, yes. It's also to prepare them for the real world and to also encourage them about the importance of research, clinical research and biomedical research, and its contribution to the general population.
Exactly. And they get to work with professionals who are experienced in this field and basically learn from them as well.
Yes, it also broadens their horizons on the opportunities that are available for them and where they can apply. Now, some students love the work that they've done here and they go on to interning after the program at Desmond Diabetes Institute with the researchers, the scientists, the healthcare professionals, and some of them also join us here at Desmond.
So they continue basically.
Yes, as staff.
Oh, wow, that's very impressive. So this is a question for the future, let's say for the next year, because this year is already been closed. If somebody wants to apply for the internship, how do they do that?
We usually announce the open application process on our social media. They can access it through our website, and they can apply using a CV and recommendation letters. This process usually starts in April. It takes 2 months
To process?
at least, and to allocate people in their respective departments.
Yes.
And then the internship starts in June. So from June to August, they get to join us here at Desmond.
That's a good, quite enough time for better exposure to the field of diabetes here at Desmond Diabetes Institute.
Yes, it is.
And it's not just in one field, it's actually, I believe it's in the different departments. They get exposure to different...
They get to join in our biomedical research departments. So anywhere from genetics, immunology, biochemistry, molecular biology. They also get to join in the medical field and the medical sector. So they can join the clinical lab. They can shadow our clinicians and healthcare professionals here. They can join the nutrition department, the education department. So based off of the interests that they care to join in, we offer it here.
And do they get a certificate at the end of that program?
Yes, they get a certificate and a recommendation letter.
That's wonderful. You mentioned earlier about the cooking classes. Tell me more about that.
Yes, alhamdulillah, those classes have been well received by the public. Now, we've been hosting the adult type 2 cooking class since last year. That's when we introduced it to the general population. This is a course or a workshop for older and mature individuals. We try to teach them how to, we teach them about carbs, because that's the most important factor. So how to measure their carbohydrates and how to measure their blood glucose levels and share healthier alternatives
Exactly.
to the foods that they already eat. Now, this year, we have the Little Chef. Yes, we've run it twice this year, and that is for a younger age group.
Okay.
Just teach them how to cook healthier so that they're interested in food, they join, and give them healthier alternatives to the foods that they enjoy.
Must be a fun experience for the kids.
It is for them.
Yeah.
It is for them, and they look extremely cute, and you can see them on our Instagram page. They really enjoy it.
Exactly. And these cooking classes, are they also available for the families who care for diabetic patients as well?
Yes, yes. For the cooking workshop, for the adult cooking workshop, yes. Caregivers and care providers can also join. However, for the younger crowd, so Little Chef, we welcome parents to join us if they care to join us. And our nutrition department would be very interested if we see interested participants in maybe creating a different cooking workshop. We're open to that if we see that people are interested and people do care to join. And we usually tailor our programs accordingly.
Now, I know this is a basic question, but are these courses free to the public, or is it there are certain fees attached to it?
No. Some of these courses are free. These cooking workshops are free for any participant who's willing to join and be a part of our group. We do offer other programs, more intense programs. These programs, if they do come with certificates, there might be a minimal fee. But for the cooking workshops, no, they're free for everybody who's willing to join.
But basically, that's wonderful. Sponsored by the DDI, you know, all the equipment and all the material is covered. I want to ask you about the access to the educational resources that we have here at DESMA. Can the general public get an access to it?
Yes. We usually post almost all booklets, brochures, educational materials on our website, desmaninstitute.org. However, there are some awareness posts that we post on social media. Those are also accessible on our website and downloadable on social media as well.
That's wonderful. We have more questions, but we have to take a short break. We'll be right back. Stay with us. Welcome back. We're still talking to Ms. Munera Al Ghanim, a Senior Public Relations Specialist here at Desmond Diabetes Institute. Ms. Munera, is there any cooperation or collaboration between you and Kuwait universities in terms of their students?
Yes. So we have worked with the School of Public Health at Kuwait University. We welcome their students here to take them on a tour of the institute, show them the importance of what they're doing, what they're studying, what they can be doing, and how it is applicable in the real world. Because public health is such a broad field. So we try to bring them over to the public health diabetes epidemic and try to show them what they can be doing in the real world, the importance of their job, and how important is public awareness with respect, public awareness, public education, public intervention, and the impact of that on the population in and of itself. Now, this is not only applicable to Kuwait University, we also welcome from public authority, nurses and nursing staff. We welcome their students, both male and female classes, and we share the exact same information with them. We take them on a tour of the institute. We share diabetes awareness information, educational sessions with them, and we try to show them the importance of the job that they're doing and the impact it has on diabetes-related patients.
So it's wonderful that how you can show a reflection or give them an insight of what to expect basically and how this will impact their future career as well.
Yes, We try our best to show them how their job is applicable in the real world.
Yes.
And the importance of their job
Yeah.
on the real world.
To see the real picture, basically.
Yes.
Yeah.
And it kind of also gives them a sense of self-empowerment, because we love self-empowerment.
Exactly.
So it gives them a self-empowerment to proceed with what they're doing, to when they graduate, they care about their patients, their people, public intervention, and the importance of that on the population.
Exactly, and increase their appreciation of their field, basically. Yes.
Hopefully.
Well, I want to ask you about how to access the resources and the courses and all the information from the public. How do they actually be able to access all that?
Yes. So for the science and medical community, if you go on our website, desmaninstitute.org, there's a subscribe button. Just put your email in, click subscribe, and we will send you a newsletter every time we have a new workshop, seminar, lecture. Sometimes
keep you updated, basically.
Yes, with all of the latest.
Yeah.
For the general public and population, please follow us on social media, Instagram, Desman Institute. We usually post all of our courses on there for people to join, and hopefully you will join, inshallah.
Inshallah. Now, in terms of the future, what are the prospects and what do you see coming in terms of increasing the awareness of diabetes for the public here?
It's a very tricky question. It's a very tricky question. We try our best at Desman Diabetes Institute to share all of our resources with the public, to keep them informed with the latest guidelines, standards, practices, scientific information, medical information. We try our best to also visit institutions, schools, whether be it through our staff, our nursing staff, our healthcare professionals, and share the latest information about diabetes, promote healthy living, healthy lifestyle. We also visit schools and institutions, both governmental and private, with our diabetes mobile clinic. I think my colleague Zakaria has also mentioned that.
Yes, he did.
And hopefully shift change in the perspective of the population on the importance of diabetes care, treatment, and management, inshallah.
You know what I like about DDI is that everybody here is so excited and everybody is so enthusiastic to basically help and get this whole mission ongoing.
Yeah.
I would like personally to thank you for all the wonderful work that you've been doing, and hopefully we'll be able to host you again in our program. Thank you so much for your valuable time.
For coming.
Thank you so much. Dear viewers, we still have more to give you, but stay with us. We'll be right back. Dear viewers, to complete our coverage of our topic of today's, let's watch a report about the efforts of the Desman Diabetic Public Relations Department during the summer. So let's watch it together.
Desman Diabetes Institute, DDI, was established under the patronage of His Highness Sheikh Jabir Ahmed al-Sabah, the late Emir of the State of Kuwait, and the Kuwait Foundation for the Advancement of Science, KFAS, to combat the prevalence of diabetes in Kuwait. DDI's mission to address the diabetes epidemic in Kuwait through focused diabetes research, integrated prevention, training, and education. DDI's vision: to be the leading diabetes institute in the Middle East and North Africa region, and to be recognized internationally. DDI has established unique, innovative, technological, educational, and clinical platforms to discover mechanisms that cause diabetes. Ultimately, we want to aid in understanding the diabetes epidemic worldwide. We emphasize the importance of diabetes education through our lifestyle, nutrition, and the Clinical Skills Center, backed up with advancement in clinical research. This is a unique institute where we have the multidisciplinary team integrated within the clinic care research, starting from diabetes education, nutrition, physical activity, pharmacotherapy, podiatry, the imaging center, with all specialties including ophthalmology, nephrology, cardiology, cardiometabolic, and periodontology. The translational research goes from the bench to the bedside and back to the bench.
Well, that's it for our show today. Hope you enjoyed it. Until we see you again, please stay safe and stay healthy.